I would like to invite Dr. Gita Dharmati as a chairperson and Dr. Suhas Khere as a chairperson. So Dr. Gita Dharmati uh, and Dr. Suhas Khere. Introduction slide, please.
I'd like to introduce Dr. Gita Dharmati.
So Dr. Gita Dharmati is a registered dietitian practicing at Pune. She is a director and founder of Gita Nutrition Consultancy. She has various publications. She is associate professor and PhD guide for nutrition in Tilak Maharashtra University. She is guest faculty for various universities and all. And Dr. Suhas Khere, who is please. So he's a MD DM endocrinology, practicing at as a consultant endocrinologist at Noble Hospital, Hadapsar, Pune. He has a panel consultant at Ruby Hall Clinic, as well as visiting consultant at Zen Multi-Speciality Hospital, Chembur, Mumbai. He also done research in acromegaly, diabetes, CGM, as well as obstructive sleep apnea. So over to Dr. Gita Dharmati and Suhas Khere for next.
Thank you very much for the kind introduction. I welcome all esteemed panelists for the next session, which is going to be the mind-body practices. So we have 6 speakers in this session, and this session going to be approximately 10 to 15 minutes for each session, each speaker, and we will have some question and answers. We can take the question and answer at the end also. So first speaker, I am introducing Dr. Nalini Kopalle. She will be speaking on the role of nutrition in exercise for the mind gymming. So her topic, and she is MD DM endocrinology. She has done her MD from the Gandhi Medical College and DM from the Andhra Medical College. She is at present working as an associate professor in Shadan Institute of Medical Sciences, Hyderabad, and also in other hospitals like Fernandez, Continental, Himgiri, and Magna Clinics, Hyderabad. So welcome, Dr. Nalini. Over to you. Yeah, please go ahead.
I'm so sorry, Monaji, and thank you for the kind words of introduction, Dr. Suhas. Exercise for gymming. That's such a mind-boggling topic and a close topic for me. I'm honored to have this topic, to be given this topic today. So, move to the next slide. I would like to say text of exercise, wherein Samhita downright in the second they have said that Samadosha Samascha Samadrukmala Prasannatatmendriya Svastha Ityate. It's that in the context of exercise, when all the fluids of the body are good, the man remains stable, his urine and feces is full, and then his mind, senses, and soul is happy, and man is healthy. So this is in Charaka Samhita, way back 2nd century BC, is mentioned about mind, body, and soul with regards to exercise. Next slide, please. So what benefits of physical activity and physical exercise on mental health? There is improved, next slide, there is improved sleep, there is increased libido, there is better endurance of the problems, stress relief, improvement in mood, reduced tiredness, increased mental alertness, improved memory. So many positives are there. Next slide, please. Exercise is beneficial for mental health. It reduces anxiety, depression, negative mood, and also improves cognitive functioning and self-esteem. Such an important thing. And in disease also, it is helpful. Next slide. It is helpful in mood disorders, anxiety, panic disorder, in depression, where there is increased anger, confusion, fatigue, tension, reduced fear. These could be alleviated with exercise. Alzheimer's disease definitely has been found improvement. There's dementia, there is improvement noted, and then substance abuse disease also. There's found to be a lot helpful when there is exercise. So how can we explain these benefits of exercise? These benefits from exercise on mind. So much exercise doing. So what is the method in which doing? Next slide, please. So there are physiological effects as well as psychological effects. There is an increase in endorphin level, increase in body temperature that contributes. The mitochondrial functioning improves and mitogenesis also improves. There is mTOR signal that is improving. And that also gives rise to a lot of benefit that we're seeing. And there's neurotransmitter production that is better, and because of which dementia is much better. You see that there is attenuation of hypothalamic pituitary adrenal axis. The attenuation of the axis reduces the exacerbated stress response and is protective. Coming to psychological, you see that the distraction from the feelings of depression, anxiety is one of the major things that happens when you're engaged in a focused activity. Mind, your regular activating system cannot process anything else. So you're distracted from the anxiety and depression feelings. There are positive feelings associated with mastering and self-efficacy, because when you put in an effort and you get the result of it, a physically exhausting effort, definitely there'll be a positive feeling that is associated with life. So what is, when you're talking about sort of exercise, is there anything specific which is called mind exercise? Something which coordinates all these things, or is it just moving muscles and hands which is causing this? Am I audible?
Yes,
Right.
please go
The
ahead. Dr. Nalini, please
a
tell.
form of mind body exercise is a special kind of exercise. We're just doing some biceps curls or hamstring curls. Those things are not mind body exercise. Mind and body, when they are synchronous together, that is mind body exercise. It is a form of exercise that combines body movement, mental focus, and controlled respiration. And this improves strength, balance, flexibility, and overall health. So there are certain examples which are there in our Indian exercises as well as in the Chinese counterparts, where we see these mind-body exercises include yoga, Surya Namaskaras, where in each step you have breathe in, breathe out protocol, and focus on breath is supreme. So controlled respiration, mental focus when to do what, and how the tummy should be breathe in, breathe out, and body movements along with it. In Surya Namaskara, yoga, Tai Chi, and Qigong, all these things that constitutes the mental exercise, mind. Going forward with this, with a flow, we are focused on this. I'm a long distance runner myself, and when we are going about distance running, going about doing an activity so focused, there is something called flow that we get into. So what are the flow states of exercise? What is this concept of flow first? Relevance in mind and body medicine, how relevant is it? Let's see that. The understanding optimal experiences is a key area of research in the field of positive psychology. So positive psychology is a concept which has come up of late, wherein it is the scientific study, it is what makes life most worth living, focusing on both individual as well as societal being. The positivities are focused there. And this positive psychology, it has to go on some framework, right? It works on the framework of something called flow. Milahi in 1975, way back, he gave this definition. He says that flow is an intrinsically rewarding psychological state which individuals experience total absorption in activity. You're totally focused out there. The perceptions of control and essence, that everything clicks together is there. And you're just focused, and that's so much positivity. Let me tell you, when you're exercising, you're focused on the exercise and you're going on with the activity, the rhythmicity, the breath, everything, the feel is totally different. And when it comes this kind of flow, it is a flow of empathy. You can see this particular slide wherein there are different quadrants, 8 components which it is divided. Next slide, please. We see that two main aspects govern the one is challenge in the level of activity, challenge, and the ability to do something, that skill that we are talking about. Have both well, doing a low challenge activity that is called empathy, like while watching a television does not require any skill. Just watch a television, just mute your watching the television. So that empathy from an activity which is highly challenging requires a focus. and requires a lot of skill that you have accrued and learned and trained. Just imagine that particular shift from apathy to flow is the main thing which is moving a person forward positively. So we redefine flow here again. Flow is defined as an intrinsically rewarding. It is not coming from it, no coming and giving you a gift. Intrinsic rewarding psychological state in which individuals experience a total absorption in an activity or totally mindful focused. And perceptions of control are present. You know what you're doing, you know what next is going to happen, you know what is happening to your body and your mind. And in the sense you're controlling the situation. And there's a sense that everything goes into place, clicks together, even in a challenging situation. That is what flow is, a productive situation. And it has technical slide, it's technically component ranging from challenges to automatic experience, that is having the end or a purpose. That having that end purpose is nothing but automatic experience. And this is what flow is all about. And it drives positive psychology. Flow has been associated with a variety of outcomes with regards to mind-body medicine. It gives a sense of achievement, sense of confidence, a positive energy, and emotions after exercise. It is intrinsically motivated. It is pretty and saying, it is intrinsically motivated.
At the outset, thank you, Dr. Vaishali, for giving me an opportunity to be amongst this august audience and the panelists today. And this is a session of mind-body practice. And it gives me an immense pleasure and an honor to introduce my own dear friend, Dr. Shilpa Joshi. She doesn't need an introduction, but to just talk about a few words about her is she is director of Mumbai Diet Health Clinic. She is practicing Indian Dietetic Association from the period of 2019 to 21. She's been a speaker, she's been into media, and she's been into various international and national symposiums to speak about nutrition. Her highlight of the biodata says she has been awarded 3 awards by Foxy in 2019, and she's a recipient of Runners-Up Award of Wim Fiber Guggenheim's International Essay Award in 2017. She would be speaking about role of nutrition in psychological health. Welcome, Dr. Shilpa Joshi, and over to you.
Dr. Vaishali, for having me here for this meeting. Now, there was a connection problem. Actually impacts mood a lot. And we know that food can be a medicine, just not for physiological health, but for psychological health as well. Now, when we think of food, we think about 2 basic components. They are macronutrients, that is carbohydrate, proteins, and fats, and of course, micronutrients, which are vitamins and minerals. And I'm going to allude to each one of them in a minute so that I promise I'll finish in 5 to 7 minutes. So when we talk about carbohydrates, we know all the guidelines across the world talk about consumption of complex carbohydrates and avoiding simple carbohydrates, especially for physiological health, whether it's role in obesity, diabetes, so on and so forth. But we also see that simple carbohydrates cause rise and fall of sugar very rapidly. So because they're high in glycemic index, you will see sugar rising and sugar dropping very fast. And this can have a huge impact on mood, probably can increase irritability and also trigger anxiety in a lot of people. And therefore, choosing complex carbohydrates instead of simple carbohydrates is very, very important. It has also been seen in various studies among children and adolescents that when they consume fast foods or foods containing sugar, especially soft drinks.
Doctor, keep the video off so that you will be much better on the audio.
Okay. So is this better? Yeah. Yeah. So it is also seen, especially in younger children and adolescents, that those who consume a lot of fast food, a lot of sugar sweetened beverages, soft drinks, have a higher prevalence of attention deficit disorder, and they also have higher amount of hyperactivity disorder. And hence, just like children, even in adults, it is advised to choose complex carbohydrates which are richer in fiber over carbohydrates which are simple like sugar, jaggery, honey, or other, maida or maida products. So it is very, very important to choose whole grains. The next nutrient that we are coming to is protein. Now we know protein causes a lot of satiety, is at the highest satiety index. But, and when you are full and you are satiated, naturally we are all less irritable. So therefore it has a huge impact on mood. But besides that, amino acids, more specifically tryptophan and tyrosine, okay, they are very, very important in mental health. So tryptophan is precursor of serotonin, and therefore it is important in mental health. And we know tryptophan, one of the richest source is, besides all the proteins, most of the proteins will have tryptophan, but the rich source is milk. And therefore a glass of milk before you go to sleep actually helps you to sleep better. Even in anxiety, it helps you. Tyrosine also helps, the other amino acid is tyrosine, which also helps to increase dopamine, which increases the sensation of reward. And very, very interestingly, chocolates, which are eaten when one feels low, are both a rich source of tyrosine and tryptophan. So therefore, you will see that chocolate, and therefore, don't get me wrong, I'm not trying to propagate eating chocolates, but a roll of cocoa or bit chocolate is important, because, and if you can have a piece of dark chocolate, not necessarily the sweetened one, you can go from 70% cocoa to 90% cocoa to avail benefits of this tyrosine and tryptophan. Also, there is another nutrient, micronutrient, that is 5-HTP. Okay, and 5-HTP is also shown to have a huge impact on emotional health. So now, Griffinophobia simplicifolia is a legume which is found in Africa, which has been shown to be the richest source of 5-hydroxytryptophan. Of course, it's not available in India, so we really do not know how to avail benefits of it, but that is one of the richest source. The next nutrient, macronutrient that we are going to go to is fat. Now, although fat is touted to be the bad guy among the whole bracket of macronutrients, please remember that PUFAs, especially omega-3 PUFAs, have shown to have a huge role in psychological health. Now, we all are aware of anti-inflammatory effects of omega-3 fats, but also there is effect of PUFAs alter the functioning and signaling of a variety of receptors, including dopaminergic, cholinergic, and GABAergic receptors, and therefore inclusion of omega-3 fats or essential fats is very important to maintain good emotional health. Now, we all know that the rich source of omega-3 fats is fish. What happens to the vegetarian population? So nowadays, it's a trend, and it's a very good trend. Among all the bad trends of foods that we have, one of the nicest trend is to consume seeds. And we see that seeds like chia seeds, flax seeds are very, very rich source of alpha-linolenic acid, which is a precursor of eicosapentaenoic acid and docosahexaenoic acid, which are long-chain PUFAs. So these were macronutrients. Now, as far as micronutrients are concerned, magnesium has shown to have an increasing role in anxiety and depression. And again, when we talk about magnesium, magnesium is widely distributed in nature, as long as you eat foods from nature and do not eat foods which are made, put into plastic boxes. So if you are not eating refined foods, you're going to get a lot of magnesium. Another very, very important nutrient in mental health is iron. And we know lack of iron will cause weakness and lethargy, and naturally cause depression in the mood. Besides that, vitamins like vitamin B1, B3, B12 also increases tiredness, irritability, and therefore can have a huge impact on mood. Last but not least, probiotics are very, very important in having good mental health. That is because we know probiotics have a role in improving. These were a few things that I wanted to say about food and mood.
So thank you very much, Dr. Shilpa ma'am. That was a crisp, and I think you covered almost every aspect about the nutrition, micronutrients, macronutrients, how they are beneficial in the mental well-being. So just to have just one question I have about the various diets what we hear about, right? So many diets they are there: low calorie diet, high fat diet, keto diets. So what I feel the Mediterranean diet, which is really close to the what ideal diet usually we see, and how this Mediterranean diet will help in this mental well-being, because as you said, omega-3 fatty acids, rich fish oils, some olive oils, these are major part of this Mediterranean diet, and really they are helpful in the mind body health. So please elaborate on that, ma'am.
So thank you so much. And the main thing is, there are trials done. So there is a trial called a SMILE trial, and there are many more trials done where they've actually seen impact of what Mediterranean diet can do on mental well-being. And what they have shown is, because Mediterranean diet is a well-rounded diet where um, there isn't decrease of any macronutrients. So what happens with a keto diet or other diets is carbohydrates are gone away from the diet. So there is one macronutrient which is out, and that can create actually a lot of mental agony. Just imagine if I tell you hands on you can't eat chapati or rice, the thought of it will put you in depression before you start following that diet. So that way, Mediterranean diet is also very well-rounded. It's very, very rich in fruit and vegetable, which will provide all these micronutrients like B complex, magnesium, zinc. They're also very rich in nuts and oil seeds. And olive oil is one of the oils which is coming from these kind of sources. Besides that, it's very rich in protein. 20% of calories in Mediterranean diet come from protein, which are basically non-meat sources. So whether it's legumes, it's fish and other things. And also very important in Mediterranean diet, the aspect which is never spoken about is that they believe in eating with family. So Mediterranean diet believes in sitting on the table and eating together, I think, which is a very, very important component in mental health. Because if you're going to be isolated and always, alone, or, so there is no feeling of togetherness. And I think that, although not very nutritive or scientific, if I would say it, but it has a lot of impact on good mental health.
So thank you very much, ma'am, for the great insight and telling us about the Mediterranean diet and how it is close to the ideal diet. Also, how the happy eating and that again in turn reflects on the mental health. So I think with this, we will move towards our next speaker. And the next speaker is Dr. Prasad Gadkari. Can we have the slide, please? Introduction slide, please, for the sir.
Yes.
And he will be speaking about the CBT spectrum, that is cognitive behavior therapy spectrum. Sir is a consultant clinical psychologist. He is at present practicing psychologist at Jodhpur, currently associated with IIT Jodhpur as well as a student counselor. He is qualified from the NIMHANS Bangalore as an MPhil, medical and social psychology. Dr. Prasad has over 30 years of rich experience in counseling and training, both in private and government sectors. He has been affiliated with the AIMS, ICMR, Delhi, Pune University, Symbiosis, IT majors such as BMC Software, Tech Mahindra, and Dinanath Mangeshwar Hospital, Pune. He had long association with disaster management and stress-related counseling while working in the government sector with extensive work at post-earthquake disaster, Latur and Bhuj. Over these long years, he has functioned as a clinical psychologist, teaching faculty, freelance trainer, as a practicing consultant in trainer in US FDA approved international neuropsychiatry research. So with this, I think, huge introduction, I will invite Dr. Prasad Gadkari, and please take over, sir.
Thank you, Dr. Sohas, for this embarrassing introduction. Too long introduction. And it's my pleasure to be on this panel of my co-panelist, and we have already had a good dose of good diet and nutrition from the earlier panelists. So here keeping in mind the paucity of time, I have made just a small presentation of a couple of 4 or 5 slides, and we will. Yeah, so I'm supposed to share my experiences regarding cognitive therapies, though the name appears, though the title appears little complicated, and there is this always hush hush tone when you talk about psychiatry and mental health and psychotherapies. So my aim of today's conversation is to uh, make this idea sellable for all the physicians, all the doctors, and what we need to see the context that we need to address mental and psychological interplay with physical aspect of illness and treatment. What I mean to say is that be a small little physical illness or a significant physical ailment, when the patient comes to you, they come with their mind and their psychological world. So what we are looking here is to integrate the body and mind in the context of illness and health, and the dichotomy of body and mind is the thing of past. So that is the context in which the cognitive interventions are important. So my idea is to give you some basic introduction. I don't have extreme ambition of turning yourself into a complete psychotherapist, but yes, to make you aware that as physicians, as doctors, you can use quite a few very simple to use techniques from cognitive spectrum. Next slide, please. So what are cognitions? You will notice that I am actually using very non-technical terms to make things little easy. So cognitions represent important side of the persona, and they include the way we think, the way we process the perceived information, the way we observe others, the way we express ourselves, our own perception about ourselves, and the resultant behaviors. This simple basic triangle, which you can see, has 3 points: thoughts, emotions, and behaviors. And we can realize that all these are reversibly connected to each other. So the way we think, we start feeling. On the other hand, our mood states have a lot of impact on the way we think, and the behaviors which we resort to, they can have impact on our thoughts and emotions. For example, a boy who is fond of rash driving, or is fond of driving too fast in the traffic, he may have a thinking of making him overconfident, and he may feel very high when he is driving the vehicle as compared to his normal emotional state. So that way, thoughts, emotion, and behavior, these are the 3 component of any personality, any person, which connect with each other, and they keep impacting us. Next slide, please. So what is the role of cognition when I am talking to you in terms of cognitive spectrum in mind-body connection? So cognitions play major role in treatment initiation, participation, compliance, adherence, failures, and also coming back to the treatment. So in our research literature, we do have studies where we can see the average time taken by a patient when he comes first time to diabetic clinic, or how long years a schizophrenic takes to come to the schizophrenia clinic, or why a hypertensive does not come to the clinic for first 2-3 months, or they take 10 months. The answer lies here, that their cognitions play a major role which affects their decision making. So when to start the treatment, how to participate, whether to be compliant or not, cognitions of the patient, cognitions of the client play a major role. Illness events, whether they are minor or major, they are influenced by deep and personal cognitions and resulting behaviors. I have given just example of eating behavior because it is very personal and private. So eating behaviors, we can see the range from food fads. We can see people doing crash dieting, binging, people vacillate between multiple weight loss advices. People keep doctor shopping. That means leaving one doctor and going to the other doctor and again changing the doctors. People keep paying a lot of fees in the gyms for not going there. So often on gymming and self-medication or totally giving up the treatment. So all these examples which I have given for eating behavior, they are applicable in any illness condition. So whether you are suffering from a very minor stomach upset to a very serious illness, you are always your cognitions, patients' cognitions are always influence their decision to be or not to be in the treatment. Next slide, please. So what and how of cognitive therapy in the context of mind-body medicine? So in a clinic of a doctor, what I perceive is that from cognitive perspective, it needs to be a joint effort of therapist and patient. Joint effort means your patient, your client, and you both together participate in this effort of getting into the treatment. The cognitive therapies aim at making the efforts to address the fears, anxiety, apprehensions, and all other negative feelings associated with the health problem at hand. It's a very common sense kind of statement which I am making right now, but we must remember that it's very rare that some of your clients or any client of yours comes to your clinic in a very happy state of mind. So once in a year, it must be happening that somebody, your ex-patient just come to say hello, hi to your clinic. But otherwise, people do come with a lot of fears, apprehensions, and mostly these feelings are very negative when they come to your clinic. And the efforts are to recognize and address the associated resultant behaviors with the aim of sustaining positive change and preventing relapse or prolonging normal phase. That means whether take the treatment of lifestyle disorders like hypertension, diabetes, whether any other illness, the doctor and client must make a joint effort to be in the treatment, follow it properly, and look for the positive changes. And once they become all right, they should be working for preventing the relapse or the prolonging the normal period. In fact, many a times when in psychology counseling services, people do come and ask that, can you guarantee that I will never have depression again? So my answer always is that, well, nobody can guarantee about any illness, whether it will recur or not recur. Our idea is to prolong the normalcy period. And that confidence, cognitive therapy techniques are very helpful to provide to the patient. Next slide, please. Now, there are some cognitive distortions which are noted all over the world in the patient. By the way, including myself, all of us do have these kind of cognitive distortions. These are a little technical examples of how do we call cognitive distortions. Distortions means the thought level hurdles in seeking or continuing with the treatment. So rather than going into each and every point written here, I would suggest I can give you some very simpler example. For example, magnification or minimization. So when in your mind, you tend to magnify your failure and minimize the small little success which your medicine is giving, it is called magnification or minimization. Okay. Take a non-clinical example of say arbitrary inference. So there arbitrary inference with when you are driving in a traffic and the moment you come to a square and the signal is red, you think that whenever I come to the square, every time signal is red. Though this has no realistic truth about it. So these are typical cognitive distortions which patients do have in their mind, and these are influenced. These are the hurdles which influence their thoughts, and they become impediment in continuation of the treatment. Next slide, please. So main techniques in cognitive behavioral realm are many, but the majorly what you do is you do focused talking, discussions, clarification. You try to challenge the fixed beliefs and give the feedbacks to the patient, feedback about what their when their thinking is becoming rigid and going in wrong direction, you give them feedbacks, or when patients show some positive change, then also you give them feedback. And behavior focus changes towards healthy behavior. So in all the illnesses, I keep giving examples of hypertension and diabetes because these are the maximum number of patients you see in your clinics day to day, in your day-to-day practices. So if a hypertensive person is making small little change while starting to walk some 100 steps or 200 steps, we need to encourage that healthy behavior slowly but steadily. So major area of cognitive behavioral techniques is talking to patient, continuously discussing, and clarifications. Next step, next slide, please. Can we get the next? Yeah. So there, as you can see, in every product, there are small little terms and condition applies. So here, the major terms and condition apply is mutual trust and the patience. Why I'm saying this? Because it is very, very difficult to be patient with your client when they ask you same thing again and again, when they are not convinced, or they knowingly land up behaving in a way which harms them, or which doesn't benefit them in their improvement. So doctors need to have lot of patience, and many a times it happens that they have to repeat the same thing again and again 100 times a day. I have read somewhere that in Western countries nowadays, they are thinking of making these therapy bots where you can imagine that just besides your receptionist, there would be a computer, and the patient would be asking this question, his repetitive questions, and the computer would be answering through artificial intelligence and machine learning. So those days are not far away, but still human to human contact and continuously modification of cognitive thoughts, cognitive intervention, they become the major hallmark of cognitive interventions. So I will stop my talk here. I thank you for patient listening, and I would be open to any questions. Thank you.
Yeah, thank you very much, Dr. Prasad, for such a wonderful talk. I think cognitive behavior therapy usually very complex what we perceive in a day-to-day practice, but you made it quite simple, and that insight really will help us to most clinicians to what we really think, how the cognition works, and how the actions we need to take, and that we need to percolate into the behavior and to channelize through the behavior. So the most commonly diseases what we come across in endocrine and diabetes practice that definitely will help in mind health. With that, for due to the time constraint, we will go to the next speaker, and if time permits, we will have the panel discussion at the end. So I will hand over to the Dr. Gita for the madam for the next.
Thank you, Dr. Suhas. Now we move on to the fourth session of this symposium of mind-body practice. And the next session talks about yoga. And it's my pleasure and privilege to introduce Professor Dr. Reinhard Beugle. As you can see from the CV that it's a very exhaustive and a very high way of looking at the CV credentials. But to be a very brief in this introduction, I would highlight his points, as he's been an alumnus of Regensburg University and has been associated with several European health promotion projects and research studies since 1985. He's President Yoga Forum Munich, European Union recognized training organization in Germany, Switzerland, and Austria in association with Munich Open University. He's adjunct professor, Center of Behavior Medicine, initiated an Indo-German collaboration on neuroscience of yoga. He's also an organizer of Munich International Symposium on Health Promotion, Mind, Body, Medicine, and Yoga. It's a pleasure and privilege to have you here to talk about yoga in mind, body practice. Dr. Reinhardt, over to you.
Yes, thank you very much for this wonderful introduction. I try to share my slides, if this is possible. Otherwise, I just will tell. No, I don't think that is easy. So I want to just start. What we know from Ayurveda modern sources is that there's a own nature, which everybody has its own nature. And this own nature is very influential because it continues through all the life. So if we talk on overweight and nutrition, we have to recognize that the starting point of the complex idea of what people eat is from their own nature, which is starting from the eating of the pregnant woman up to the nutrition of the baby and so on. And so the whole body and mind as a person has this background. This is the starting situation as we have it in Yoga Sutras. We say this is Chati, the starting situation, and we have to act with this starting situation to continue. And then nutrition as a whole is thought in yoga is you replenish what you have consumed. And this is a very difficult task, practically speaking. Conceptually, it's very easy. You replenish what has been consumed. Like a car, if petrol has been consumed, you replenish the petrol. So each and every tissue has a own need, and this need has to be replenished. This is what most of the time people don't do. We have an example, there's a 32-year-old musician in Germany. He has 160 kg, and he wrote a book about his food and diet and eating and hunger. And he said this one sentence: most of the time I was not hungry when I did eat. So he did eat because of different other reasons. And this is one of the points where yoga tries to reconnect mind and body with the hunger. So the basic idea is the tissues of the body send the information to the stomach, and the stomach gives the information to the tongue, and from the tongue and the stomach, the mind can read the need of the tissues. So this is why we do the yoga asanas, one of the reasons to get connected with the muscles, with the skin, with other parts of the body to start to learn to read the information of the body and to convert it into a proper behavior, as our last speaker has already wonderfully pointed out how this whole cycle works. Then The point is the best time is in the morning after shower to have some yogic asanas, because then the night is over, the tissues had time to refill at night, the mind had time to shift the information to the memory, and there's a new clear situation where good information can be read from the tissues. Then also morning is a very important part, because in the morning, if you do some bodily action, the metabolism that we know from sports medicine has a higher rate 12 to 16 hours after it. So the whole day, if you do 20 minutes or 10 minutes something in the morning, the metabolism is the whole day higher. If we do it later for sleeping, this is either you can't sleep or the metabolism has to down-regulate it for sleeping. Then we like to have a longer stimulation for the tissues to can read them better. Then this is the main point, that we think with this connection of the own mind with the own body, a person has over the months and years, and Professor Gangata has nicely in his lecture today brought the points of yoga, and I think everybody has seen this, so we know that there's a important influence on the brain and the hormones and all these structures. And we think that we need a little bit a longer period. They did 6 months, and we think up to 1.5 to 2 years, this would be a good period to influence this and to become start to be the own master of the own body mind. And I will switch the camera and I will show a few starting asanas which everybody and every patient can do. Also 2 years back in the first Synapse conference, the whole hall was doing this asanas, hundreds of people. So first asana, as you everybody knows, is Tadasana. You just stand. Switch the camera a little bit higher. So this is standing is a very good measurement for, and we are here in a hall where we yesterday and today will practice yoga for yoga teachers. So you just stand, and standing is a little bit active. So the standing is to activate mainly stretching muscles. And you all know from biomechanics that we have these 2 types of muscles, muscles which are bending and muscles which are stretching, biceps and triceps. And some German anatomical professors, they say the biceps is the eating muscle. So in Tadasana, we try to activate the triceps and to relax the biceps. So in this sense, a little bit of eating behavior also is relaxed. And then we ask people to observe their own tissues, skin, muscles, possible bones, to have deep breathing, and so on and so on, to get this connection. Then the second asana is you can have 2 on the wall or on the stool. You make this half dog pose. You can make it on the table. Again, stay there for some time. And what is very important also to teach the people is about the whole stomach area. A lot of people, especially when they have more weight, the stomach comes out and the chest sinks. And this again brings the stomach more out. So we try to have a position where the stomach can relax to the back side of the trunk and the chest can get more space, more place, more opening, more freedom, and the breathing can move, and the stomach organs can relax. So you understand this is a method to change the body awareness and the connection to the parts of the body and to start them, to have more connection to the chest and the lungs, and to have relaxation in the whole stomach. Then, of course, you can have going down in Uttanasana, again, relax the stomach and the body and activate the chest. And then, of course, as everybody knows, you can make Shavasana in a way, also maybe with a stool, to have the legs on the stool. It's easier to relax the stomach and to get the chest in a more activated manner. With the legs on the stool, the belly can relax better. So these are the types of asanas which we can start with. Then, as Vaishali mentioned, a very important question that what to do with people who are not in a position to make these asanas, as I have showed, and a lot of overweight people, and I had people like that, they had very much difficulties to make these positions because of the overweight. Then we start with the so-called mental training. Mental training means that the person just in the mind makes these activities in a very clear and active way. And we know from research very well that people, when they make like this biceps training, they can make it really. This is 100% training. And if they just sit there and mentally move their arm, then after 6 weeks, they have 60 to 70% of the increase of the muscle power only with the mental training. So we know 2/3 of the training is a mental part. And so this mind-body connection can be used in this way for people who are not really able to make the whole positions. With that, I will end. And if there are questions now or later in the discussion, we can have them. Thank you very much.
Thank you, Reinhard. So I think in a very short time, it was so wonderful to give a brief understanding of circadian rhythm, time of doing yoga, and also the demo of the various asanas, which will sync your body and mind to make you more mindful, to make that activity in a sync with your body clock. So thank you very much. I think there are no questions on the chat. If time permits, we will take it at the end, if there is time. So over to Dr. Suhas for the next session of this panel, and then we'll see at the end whether we can take the questions. Thank you, Dr. Reinhard, again for giving us this time. Thank you.
Yeah. With that, we will move towards our next speaker. Our next speaker is Dr. Dhananjay Chavan. He is a psychiatrist. He is based at Pune, and sir will talk on the meditation, how the meditation is helpful in the mind-body practices. To introduce sir, sir is a psychiatrist. He has a vast experience of 24 years in this field. He did his MBBS from the University of Pune in 1998, and he's done his MD Psychiatry from the University of Pune in 1991. So with that, I will hand over the session to Dr. Dhananjay sir.
Thank you, Dr. Sahas. Thank you very much. In this session, right at the beginning, we listened to Dr. Nalini. And as I was listening to her, it was so clear that the question that she asked right at the beginning was, when do bicep curls become a mind-body exercise? And when something is just a physical exercise? I think that is where meditation comes in. Then we listened to Dr. Shilpa, who obviously we are all aware of our old adage about health, yuktahara viharasya. And while answering a question right at the end, she said it is important how we eat something, not what we eat, but how we eat. And that also is a question that is a point that I'm going to take further in this few minutes that I have with me. We also listened to Dr. Prasad, my old colleague, who made such a lucid presentation on CBT. And one important aspect he mentioned was emotions and awareness of emotions. Obviously, a lot more attention was given to thoughts. So that also is another important aspect of meditation. And yoga, I'm going to talk in the last minute of my short talk on meditation, because it's a wonderful exercise that combines, and that is an ideal example of mind-body medicine and mind-body practices. Now, what is meditation? We all have unfortunately been reading Amar Chitra Katha ki isne dhyan kiya, usne tab kiya, fir usko brahmastra prapta hua. And that has sort of skewed us as children towards thinking that it gives us some supernatural powers. Or sometimes it is just looked upon as a mystical thing. So because we have a very short time, I am going to try to demystify meditation and trying to give the basic fundamental principles. Most of the audience is doctors, and they have all done a lot of presentations where they start with saying patient is conscious and attentive and oriented. That conscious and attentive is what meditation is, with one additional thing. So what is it that makes conscious and attentive into a meditative state? Conscious, we say, what is consciousness is awareness of self and the environment. And attention is ability to focus on one aspect of reality, subjective experience, to the exclusion of the rest. And that is exactly what is done in meditation practices. Now, unfortunately, India has such a huge treasure trove of ancient practices, but they mostly use different terms. And that is why there is no harmony. In one meditation practice, something is called Ananda, something is called something else. And that is why it was good to hear to Dr. Nalini to try to distill it down to modern terms. Now, there are basically two meditation practices. If you look at all the meditation practices of India and the world, there are two basic fundamental meditation practices. One is that of absorption, which in ancient language is also called samadhi, dhyan. So that is where there is one-pointed concentration on an object. Now, that object can be an outer thing like a flame, like some picture, a mandala, or since you are in Maharashtra, Vithobachi Murti, anything. That can be a point of concentration, and one focuses only on that. Now, sometimes that focus can also be an image inside the mind. So it need not be an external object. It can be something inside. Now, a young man or a woman in love cannot get the image of the lover out of the head. And somebody who has always Vithoba in front of the eyes, what is the difference? What makes one meditation and what doesn't make the other thing a meditation? So the important thing there is in this one-pointed concentration, where you focus on one aspect of reality, any object, and you continuously focus on that, one very important fundamental difference is the state of your mind, whether you are feeling calm at that time. And then there are other things. As Dr. Renard said, there has to be training. So meditation is not just sitting idle. Meditation is hard work. Meditation takes time. It takes training. And that is why a lot of the people, when they start, they come with expectation that I will start meditating and then soon I will be very happy. No. Just like when you go to gym, first few days you are going to get aches and pains, and then you will get into the rhythm. In training our mind, we say Fandanang Chapalang Chitta. Mind is very fickle. It takes even longer. So this focusing on one aspect of reality with purposeful, continuous effort. And as you are making these efforts, there is also a conscious attempt not to get upset. So there is a continuous effort to stay focused on one object for a long period of time, and also keeping mind calm. And ultimately, this results in various states that are called various things by various traditions. So these are just states where there is a continuous attention on an object with a very calm state of mind, where you only have positive emotions. You have Karuna, you have Maitri, what we call Brahma Vihars, the four things, Mudita, Karuna, Maitri, Upekha, which means equanimity. That's one important tradition of meditation. The second fundamental tradition of meditation, which is we all have touched upon in various ways in already 3 sessions, and then Dr. Komal is going to take it further in the next session, and that is mindfulness, which is samagrata. So the aspect of meditation that I talked so far was ekagrata, where you are focused on one thing, that is ekagrata. And then there is another meditation, which is samagrata, where you are aware of whatever is happening. So you are aware of whatever is happening. You are aware of your emotions. You are aware of your actions. Like Dr. Renard said, your skin, your muscles. And that is why, for most of us, Yogasana, is a huge and deep philosophy, but for majority of the people, it is Hatha Yoga. Any good teacher of Yogasana would always teach awareness along with those asanas. Those asanas are very important, but unless this aspect of awareness of your position, of how you feel about your muscles, so this awareness of your physical state and then awareness of your mental state is very important. And that is why yoga is a very good mind-body exercise, because in any good yogasana practice done properly, there is always an element of mindfulness attached to it. Now, coming to mindfulness, it is not just about awareness of body. There is also awareness of emotions. And this subjective experience is something that the West was a little late to catch on. Admittedly, there was a huge research done through the centuries, and in studying nature outside, they made leaps, huge leaps. And one thing that came a little late was the phenomenology aspect, the subjective experience aspect. And that is where mindfulness is very important. And that is what cognitive behavioral therapy tries to achieve, is to make the person aware of what is happening. And so sometimes a very simple exercise that clinicians like Dr. Prasad give is just note down, how was your day in the morning? How was your day in the afternoon? So at least you are aware of what emotions you are having. That awareness is very important. Obviously, if you go to a spiritual teacher or any meditation master, they would say it has to be moment by moment. Every moment you follow it. Not always possible. So even there is another thing that can be done is called pratyavekshan or sinhavalokan. Oh, 5 minutes back, I have lost control. I got angry with my colleague, with my subordinate. I was upset with my boss. Even that awareness properly accepted is meditation. And that is why any daily activity that you do with a calm mind, with positive intention, where you are aware of it, even if it is washing dishes, sweeping floors, can be a meditation practice. You don't have to spend extra time. Only thing you have to do is, during this time, I will not look at TV, I will not look at mobile, and I will just focus on what I'm doing, whether it is drinking tea, having breakfast, that is the proper way of eating breakfast, or eating lunch, or doing anything else, taking bath. So throughout the day, we have several opportunities where we can be mindful of what we are doing, mindful of our posture, mindful of our sensations, mindful of our emotions, mindful of our thoughts. That awareness is what is a very important aspect of meditation. So here what I have tried is to go to the basics of meditation, ekagrata and samagrata. And with that, I will stop as we are running out of time, and I will hand it back to Dr. Suhas and Dr. Dharmati.
Yeah, thank you very much, Dr. Dhananjay sir, for such a nice, elaborative, and I think you have made us with a very intricacies of the meditation, how it is a focused one, and it's not just the one aspect, but and now with that, I would like to thank you. And next session will be with Dr. Komal Verma. Dr. Gita will introduce her.
Thank you, Dr. Suhas. I think we come to the last session of this section. And this session is on mindfulness-based stressed relaxation. So it's my pleasure to invite Dr. Komal Verma, who is a psychologist. She's from Amity Institute of Behavioral and Allied Sciences, Amity University, Haryana. She's conducted many workshops for corporates, public and private companies, including the medical education programs. She's been awarded as Research Excellence Award, Healthcare 2020 by Global Research Foundation. She's associated with Project Dawn, which is Diabetes, Attitudes, Wishes, Needs. And she's also edited books on facets of healthy mind and body. Thank you, Dr. Komal, for joining us, and we look forward to hear from you. Over to you.
Thank you, Dr. Gita and Dr. Suhas. Just to add, currently I am working with the Montfort University, Dubai. I have just came here as a program leader. And I think the base has already been set, and as being the last part of this whole deliberation which happened, which talked about mindfulness-based strategies that we were talking about, eating mindfully or exercising mindfully, and at the same time adapting maybe cognitive behavioral therapy and meditation. So I think mindfulness-based stress relaxation just become part of it, and it is really essential to focus on how, what, and how we can achieve it. So in next 7 minutes, I would just talk about what is MBSR, how we have to focus on the present, and what are the facts of the process and why we are doing it, what are the benefits. Because unless we know, I think we are not motivated enough to start doing it or believing in it. So mindfulness is all about being fully awake in our lives, and the concept is well promoted by John Kabat-Zinn and brought to medicine as well. And when you talk about MBSR, it's a blend of meditation, body awareness, and mindful movement. So it is like learning through practice and study how body handles and can resolve stress neurologically. So we always say mind, body, they go hand in hand, and they share a very good bidirectional relationship with each other. So ultimately, talking about having stress in our lives, not able to have a good sound sleep, or having burnout, maybe while handling the patients, or maybe patients having the burnout in their overall life by following the strict treatment regime that they are into. I think everyone goes through this situation. And so that's why it is really very important to ground ourselves in the present reality, and that can only happen if we are really able to use all our senses properly. So maybe the 5 senses that we keep talking about, but are we really taking care of those senses? Are we really using those senses in a better form? because we have to really understand, being on the virtual platform right now, maybe, vision and maybe the auditory mode is something I am just focusing on. So, but what about maybe the other things, right? So maybe the touch is something I'm missing. At the same time, the smell is something I'm missing. So definitely, if you want to have an overall experience, the people who are actually in those particular settings have a different kind of perspective overall. So it is really very important to understand that how these five senses, work blendedly with each other, and how our emotions, thoughts, and memories are really being formed, and how it affects our mood, and further how it really affects our present behavior that we are behaving. So mindfully, we really need to have an understanding that any one sense can be dominating in one's personality. And if you're not utilizing other senses, it can really lead to a lot of misinformation which comes to your mind. You can lose a lot of information, and on the basis of it, maybe you get confused, burnout, fatigued, or stressful. And so it is we don't believe in facts till the time it has been proven. So we have seen that science has really met mindfulness in a lot of ways. A lot of researches are being going on. We have just click on Google search and you'll find a lot of news which is there readily available, and which talks about that how mindfulness is really affecting our brain structure. So we say when we are in stressful conditions, and a lot of studies have proven that our prefrontal cortex is actually shrinking because of the kind of stressful conditions we are into, and that is how our brain changes. So it means brain wiring can change. So if it is changing in a negative way, why not we just focus on it can really change in a positive manner at the same time. So there was a research done by a Harvard student, and it was seen that 8 weeks of MBSR practice really led to a lot of changes in the whole hippocampus, and showing other regions where meditation was happening and how it was affecting your learning, memory, and other cognitive skills. So it means there is a proof, and maybe a lot of things can change if we practice these things. And again, as I said, just Google search and you'll find, it was just a list, I took it out yesterday. And so we can see using of mindfulness and relaxation based techniques are really helpful in a lot of disorders and treatments. So there is a science, there is a prevalence of it. And that's why I think it is good that we talk, and good that we ponder upon it, and maybe implement in our daily lives. So how it works is it's a process. There are various programs which are there. There are various methods by which people start doing it. But I think the first point is you have to be simply aware of who you are, what condition you are in right now. So it, as Dr. Dhananjay was simply mentioning it is all about living in present, right? You really have to press the button stop, and you have to think, okay, so now what is happening right now? So basically, it is all about training your mind to slow down the racing pace of thoughts and taking out the negative things, and just correcting, okay, this is my current situation, and that is how I need to proceed. Attention and your brain. So you have to really focus on what is going on inside the mind. Now, for example, if you are switching from one patient to another and you have few seconds in between, so maybe you are really burned up in that situation, completely fatigued up. So maybe you can just give few seconds and just ponder on what is going on in your mind, and you can just alter it quickly, that okay, this is my current situation. So ultimately, it is more about what is your intention. So you have to focus on the purpose of your thought coming, your intention, and then what you're doing in that present situation. That's how you'll be able to deal with your thoughts in a better way. And then responding, or you want to react very quickly. So, okay, things are coming in. There might be a lot of situations outside, but is it really necessary to just react, or you have different ways to react? So it is always, as I said, there is always a green, it moves like a red light. So green is there, then you have an orange light, or maybe then you actually say, okay, go. So we really need to focus on and understand what kind of reaction we need to give. And it might take just few seconds. So dealing with difficult emotions or physical pain. So a lot of time we consider, pain. So please understand, pain is and as a pain, right? We have to take it as a pain. We can manage it. So as other speakers have said, we should be accepting what is happening with us rather than just being in a denial mode. And that can really happen by being compassionate to yourself, that, okay, things might happen. There are stressful conditions in our life. So we can manage it, and we have to be compassionate. It's okay to give mindfulness breaks. We can always have maybe a few seconds break, just thinking about, okay, how am I? Just take a deep breath and understand the situation. And then maybe communicate with yourself and with others as well. So it is okay to communicate, with other people. So benefits are, if you start practicing it, and we have seen there are a lot of results, it helps in reducing your stress level, reducing your pain, or increase your tolerance of pain, which you face in, normally everyday life. It helps in overcoming the disturbing thoughts and the events that you are into. And it helps you in living the moment right now. Now, for example, if I just ask you to put your both palms on the belly, and if you just close your eyes and just focus on, inhale and exhale. So that movement of, breathing will try to help you understanding whether you are able to focus on that particular sense, and whether you are able to bring your attention to that present situation. And are you able to just feel that breathing that you are into current state of just inhaling and exhaling, or still there is other noises which are disturbing you? So there can be other things around you, but still it is said that this kind of practice really helps in boosting your mental health. So it is not a cure, but it is a supporting system which can help you in overcoming the other problems and the diseases that you are going through. And it's further, which we have seen the therapeutic effect of it. It can help in reducing your anxiety, high blood pressure, depression, chronic pain, migraine, other related ailments, which can be a dual benefit effect which can be created. So whenever you have time, the suggestion is just give it a try, because when you believe that it has a scientific base to it, things are working, chemicals are changing, I'm very sure you'll be able to, accept this technique, and maybe just practicing few seconds a day, few minutes a day might bring a lot of difference in your life.
Thank you very much, Dr. Komal, for such a wonderful talk. I think mindfulness, how it is important in the stress management. Wonderfully you depicted with a nice presentation and a few slides as well, and thanks for sticking with time. I think we don't have many questions in the chat box with the listeners, and we are at the end at the moment. Dr. Nalini, are you there? If you want to add something, because you at the beginning there was some glitch and we could not hear you properly.
Sorry, apologies for that. I wanted
No problem.
to make 3 points very, very clear, because this is a very important concept when we're talking about mind-body medicine and mind gymming. The concept of mind gymming and the flow is very important. Flow is when you're giving your 100% to an activity, right? This flow concept is very important to understand and go positively in life and improve. So this goes as making a 3-segmented approach into 2 categories. First one is challenges. Challenges are categorized into mild, moderate, and difficult challenges. And skill levels is less skill, more medium skill, and maximum skill. So these are when we divide this, think of it an x-axis and y-axis, and we are dividing it into different quadrants. There's an activity you just don't need any skill. You just don't need any type of challenge. It's like sitting in the chair and then watching a sunset, right? That activity is called apathy. You're not doing anything at all with your body and with your exercise. From there, with self-motivation and everything, you increase your skill base, and gradually you move to a very high skill. But still, if challenge is low, it is something like reading a textbook, reading a medicine textbook or endocrinology textbook, right? So reading is a thing which involves skill, but it is still the level of challenge is not much. Next is you increase that skill and you increase the challenge level. That progressive increase in skill as well as challenge will lead you to a state which is called flow. wherein you're very skillful in what you're doing. You achieve that skill by training, by doing an activity repeatedly. And then you're focused on that activity and you're solving the challenge. Just understand the effect of it and what you get in return when you're highly focused. The positivity pushes you forward and lets you improve. It pushes you out of your less motivated state and makes you productive for your own self, productive for the society. This is a concept which has been put forth to help increase the activity both physically and also mentally, and they also say that spiritually because it is a very gratifying process.
Absolutely. I think that was a great insight. I think how this flow concept you depicted to us, and how this flow concept really is. Thank you very much, Dr. Nalini. Any panelist want to give some comments? Anyone would like to speak? Please unmute and speak.
Any questions?
I think no one. Any questions? Yeah.
I think no one.
Yeah. I think due to time constraints, and we have now at the end of our session, and I would like to thank all the panelists here, right from Dr. Nalini, Dr. Dhananjay Chavan, Dr. Prasad Gadkari, Dr. Komal Verma. So all the panelists, I would like to thank. Also, Dr. Reinhard, he also gave us a good insights. He demonstrated the different yoga poses, and Dr. Shilpa Joshi madam as well. Also, I would like to thank Dr. Vaishalideshmukh ma'am for giving us opportunity, team Synapse, and for all the technical team as well. With this, we will wind up this session and we will go towards the next session. Thank you very much.
Thank you so much.
Thank you so much.